Back at the clinic, Dr. Brenda's first patient of the day, Remington, a frisky young lab, had a serious run-in with the back of a trailer.
We have an 8-year-old dog also, so they were running around like they always do, and the end of the camper caught him on the back. There was a lot of blood.
As he went underneath the camper, his skin got caught on something and literally like lifted it up. So he's got basically sort of a 3-sided tear. Certainly the size of the laceration that Remington has is enough to make most normal people a little bit concerned. It's kind of gross looking.
I was pretty freaked out. Maybe a couple tears, which sounds a little crazy, but I'm sure you guys understand.
For Remington, as we're doing his preparation of his wound, we're trying to get good, fresh tissue, fresh edges. Because this injury occurred as sort of a tearing type problem with the skin, the edges are not real fresh, they're not real sharp. So what we want to do is use scissors and just clean this edge up so we've got a nice fresh cut. Skin flaps are always challenging. They're usually big, they lift up a bunch of area. Sometimes they do really well, sometimes they don't do as well as we'd like them to. It's all based on how the circulation is to the skin flap, how much circulation was damaged.
I'm definitely worried a little bit, but I think he's in really good hands right now.
Jen, could you come up with a drain for me, please? Because of the length of the skin flap, I'm going to put a drain in under the skin. This is just to make sure we don't get an accumulation of fluid, serum under the skin. It's a way to help it heal faster. All right, that looks pretty good. Prognosis for Remington is pretty good. This is really just a not very deep cut. It's pretty large at this point, but I think we'll have hopefully a good turnout as he begins to heal. Okay, can you stand up? Oh, look at that. All right, we're underway. Left turn there, babes. Oops. Hang on, Remington. Here we come. There you go. Look, there's your people.
Hey, baby. You okay?
Yep. Now he's liable.
When Remington first came out of the waiting room, he still looked pretty rough and he was really dazed, but it was such a relief to know that he was okay.
Doctor's orders?
Reach for you.
Rem, come here, bud.
Rest and a return visit to have his stitches and drain removed.